Okay, folks, so we are back from our coffee break. I was mentioning that on the chairs we left index cards where we want you to write out your questions, because at the end of, well, later on, before the session ends, we're going to have a questions and answer blowout session. So any questions that you have, concerns, things that you need clarifying, put it on those index cards and we will address it at the end of today's session, okay, as part of one of the presentations. Now, we're going to get into the topic of health insurance. Besides banking, besides residency, purchase of property, that is another very popular topic, because it stands to reason that if a person wants to relocate to the country, especially if you're a retiree, you know, what kind of health insurance is available, okay? What does it cover? Is there an age limit, all right? What happens in the event that you're over the age of 65, okay, or a pre-existing condition? So, we're going to invite Javier Bobadilla. He happens to be the person that provides the insurance for my companies, okay? And he's going to talk to us a little bit about health insurance in the DR, and at the end also take questions, okay? So let's give the floor to Javier.
Thank you. As Maria says, it's a popular topic, right? But not a popular topic because all of us want it. It's because we need it, right? And that's interesting. Well, after all, I'm gonna talk a little about me so you can know what I'm doing. I'm Javier Bobadilla, as Maria told, and I am an insurance assessor working in the insurance field for more than 10 years in the country, since I was a baby, almost. No. Well, and I am working for Humano Seguros since 2016. And it's interesting because this is one of the companies that start fully in the insurance field with health insurance after the law in beginnings of the 2000s. And talking about the health insurance, as we talk, it's a popular topic and very necessary topic, because as we know, if I can ask you a question, maybe you will answer with an obvious answer, and it is, have you ever been sick? Of course, we all have been sick. And not just because for the lifestyle we can get, but also as natural as genetic diseases that we could get and inherit in our time living. And maybe someday we could have something that allow us to live without that preoccupation. What happens if I have an accident? What happens if I have any disease, any major disease? And until now, just right now, we don't have any solutions like that. So what we have to do is be prepared, make plans, and organize all that we can, all that we have in our hands, and make decisions now that could help us in the near future when those kind of situations arrive, and affect us living, right? Because without health and wellness, anything else is in second place, or we can get any other things. And maybe in the process, now that you are changing your country, it's more important, because maybe you have fully coverage in your country. But now when you change your country, you have several questions. Questions like those ones that we're going to answer right now. For example, how health insurance works in the country, and why Humano Seguro, as an insurance company, you could choose to have your health insurance. Which are the insurance plans that we have available where you can choose from? Am I an insurable person? And this is a good question, because maybe if you have some condition, maybe because of your age, or maybe other question, or some people talk about the health insurance in the country is not that good to have it. And we're in a good time, and we're going to see why in just several minutes. We'll talk about several exclusions and exceptions that the insurance can allow or not. And after all have been said, where to start? So let's start talking a little about how health insurance works in the country. And there's there are two ways that we can access to the health insurance. One of them is through this Dominican Social Security system. And to access that way, you need to be working for a local company, right? And as an employee. And it doesn't have limited age to get it, that coverage in the basic plans they offer for us. And it's interesting because mostly people could have that health insurance in this way because there's a great amount of people working in the country, right? But this is a mandatory insurance. That means they have a pre-established coverage and you can change at all. The main difference that people will have is the health risk manager they're choosing and the customer service that company has to offer. And the other way, and this is the one you might be interested, is the voluntary plans, where everybody in the country working in a local company or not can access to. And in a local private insurance company, as Humano, you can choose from an individual insurance, which means for yourself, your spouse, or your children's, or as a group, collective, which means your own family, but also others that you can add in that policy. But no matter which form you choose under the voluntary plans, you can have access to change your coverage, to increase or decrease the option that they offer, or also you can choose if only nationwide or even international coverage you could have with voluntary plans. Also, you can choose the payment form you would like to use, annually, every 3 or 6 months, or monthly. You have those choices. But inside the voluntary plans, there are good variety to choose from. And we're going to talk a little more in just a minute about the different plans Humana has to offer. Well, why Humana? And we talk about real quick about the company. Humana have, as I told earlier, has almost 20 years in the insurance field in the country. And they have been honored with several prizes like for Great Place to Work, for customer service, and also, as important mark in DR, they push further the market, and we saw that during the pandemic, where they changed the form to access, not just physically, but with digital ways, as we talk in a minute, as we're going to talk about in a minute about it. And Humano have both access that we just talked about. In the Dominican Social Security system, through Primera RS de Humano, which is the most chosen company in that option, and through voluntary plans, a local private insurance company who calls Humano Seguros. And this is the one we're going to use to access to the insurance plans we're going to talk about. And this is the insurance company, the biggest insurance company in terms of productivity in person insurance, not just health insurance, but life insurance and others like that. Humana have a great customer service, not just when you are face-to-face with a person, not just with me as an assessor who can know immediately your needs, and go to the company, expose them, and look for solutions so you could have of your specific needs that you have. But also through officials call centers, through 3 regional offices that are in Santo Domingo, Santiago, and La Romana too, 21 service offices, and 14 stands and more. These stands is not as big as the offices, but are more personal. And you have access in the clinics, hospital, and laboratories that have a representative of Humano, who you can ask any question that you have in the right moment. And have Punto Humano, which is a system that you can use digitally. In the moment, you can access to authorizations and more information about your policy in the same place that you have. But also, a part of that has a great provider networks. As you can see, more than 300 clinics, more than 200 laboratories, more than 300 pharmacies, and more than 6,000 doctors, and improved any time, any year, for getting a better provider network. And also you have access, you can download through your mobile application, which is called Humano app. Through this application, you can access to authorization for some procedures that need authorization before you have to access to them. Medicine and pharmacy to look what coverage do you have in the moment. Access to refund, and the refund, don't get me wrong, it's not because Humana doesn't have coverage in that moment. It's because outside the network, we have so many doctors, clinics that for their own, or because they don't feel the request to access to the network, they don't offer services for Humana. But you can access anyway, and with the receipt, you can present it in the application, and you will get to refund up to the limit of the plan that you choose. Also, you can make inclusion through the app, access to your digital card, and clinics and doctor wherever you are in the country. You can access to the locations they are. Okay, we have another more part of the company, which is called SARA, for the mean in Spanish. It's a virtual assistant you can access through the webpage of Humano and via WhatsApp too at that number. Okay, let me took the picture. All right. Now, it's not just necessary to have an insurance that guarantee the coverage that you hire in the moment that you need, but we also need to be healthy, right? If it depends on us, we can hire the insurance and not use it. It's very comfortable for us. It's very, we can feel very happy in that moment. But in the moment that you are healthy, maybe you don't feel that you need the health insurance. That's why Humano Seguros have several advantages that you get access to as a way of preventive, to know how to take care of your body, to keep you healthy. And also, when you present your insurance card in several places, such as those categories, in wellness, maternity, nutrition, entertainment, and other services that you can learn more about it in that webpage, humanosonrisa.com, which is the name that those advantages receive Humano Sonrisas. Okay, let's talk about very important things. Which are the insurance plans that Humano has available where you can choose from? Well, we can talk about the local plans. As we talked earlier, there are only nationwide coverage in different limits you can choose. And the other side is international plans. Either national coverage, but also it offers international coverage in different parts of the worldwide, right? Okay, let's gonna focus in on the local plans, because if you are choosing to move to the country, maybe you have insurance wherever you live right now, so you need the coverage only in the country for the moment. So Humana has those plans. Platinum, which is the best local plan we can offer. The Prime, which is a Platinum wannabe. The Max, which is a lowest coverage, but is one of the most popular plans the people choose right now. The Royal, Superior, and Essential Plus, which is a similar, the last one, Essential Plus, which is similar to the one that Social Security system offer, mandatory. But this one is a voluntary. If you don't work for a local company, but you need insurance, maybe not that higher, you can choose that one too. So let's concentrate a little in the in the Platinum. The Platinum plan, as we can see, has 100% in almost unlimited coverages in those situations: emergency, outpatient services, psychiatric and psychology services, laboratory and X-rays, vaccines, outpatient procedures, physical therapy, outpatient medicines, and special study. You can look at the top in outpatient services. It says unlimited payment difference per doctor consultation. In the country, the plan that you have full coverage, but doctors request a difference of payment. So maybe one doctor can ask you for 1,000 pesos, other for less, and other for more. It depends on the doctor per se. The insurance have a coverage of that and an agreement with the doctors, but that's the way it works when you are in outpatient services. And the refund we just talked earlier, you have up to 90% in this plan outside the network, right? Within the network, you don't have a refund because we are assuming that you always have the coverage that you hired, right? And this plan have special options in addition of the default coverage they provide. For example, the Platinum services. It's a customer service that only this plan has. If you have other plan, you can attend a great customer service as we just talked to them, but this one has a special customer service just for habit. And exclusive Platinum benefits. If you need to use the refund facilities, you will have access to, in less than 15 minutes, in amounts lower than 30,000. And Dental Platinum, he has its own network to access to the dental coverage in these plans. And other benefits, as traveler insurance included in the plan, with up to $10,000, and inpatient coverage at 100% and 90% in refund, as you can see. Other coverage that this plan has is within the network, catastrophic or major illnesses. It has covered up to $2,500,000 per year. This is the top limit you will have annually renewably in this plan. And other services like force assistance, when you need security and you're in the road or something, you can call through the access of this plan to that option. Airport VIP in Santo Domingo Airport and El Cibao in Santiago, and Advantage Miles. You can get it with having these plans. Okay, let's talk about now the other plan, the Platinum Wannabe, because it runs the same network. You have similar coverage, just limited to 90% and not 100%. That's what you're talking. And it also has refund too, but has a cap in that point, which is in the outpatient services and psychiatric and psychology services, 90% up to 5,000. Sorry. And other coverage it has, in inpatient coverage, it has refund to 90% and 100% up to 6,000 per day on hospital runs. Okay, the other coverage it has, you remember that the Platinum have the coverage up to $2,500,000, and this one in major medical expenses has up to $1,500,000 per year. This is a major difference here we can have. And look that the dental plan is different to the platinum one, because the platinum one has a dental platinum exclusively access to coverage through this plan, but this one has dental humano, which is options inside the country in different places you can choose before or when you're choosing the plan. But you have access to highest dental options, the platinum inclusive. The other one is the mats. Within the network, you can see a major difference here between this plan and the prime and platinum, and is the percentage of coverage within the network. This one has 80% in almost all the coverage, except in a special study, which is 85, and also in outpatient procedures. And the refund that they have is up to 80% now, with a cap of $2,000 per doctor consultation in outpatient services. Okay, and the catastrophic or major medical expenses here in this plan is up to $1 million per year. So we can see the difference between those plans. But I take it here so you can have a better idea of which are the difference in those plans. The major difference you will have in those three plans that we just talked are coverage percentage, 100%, 90%, and 80%. Major medical expenses, $2 million and more, $1,500,000, and only $1 million in the mats. And the network of each plan. The prime and the network has the prime and the platinum has the same network, but at the limit of the prime has, right? And without the options at customer services and dental platinum by default in the prime. But the mats also have a different network coverage. That means if you go to the best clinic of the country, for example, one of them, Abel Gonzalez, for example, maybe you will have coverage in the platinum and in the plan, but maybe not in the mats. That means that is the principal difference in the network that we just talked. And, of course, the included benefits and the options that you have in every plan and the percentage of refund that each plan has. Okay, maybe we can tell exactly how much you going to pay in one of those plans, because we need to make a specific quotation for you so you can have a better idea how much you're going to pay with specifically payment options and coverage. But I know every one of us has to know a better idea how much going to pay if I change the payment form and that stuff. So I make an exercise, I make an example so you can show it, so you can see it. And in the platinum, if you choose for one person, payment form for 1 month, it's going to pay 10,570 pesos. Those plans are only in pesos. If you choose, for example, the prime for one person with the payment form of 3 months, you're going to pay 18,840 pesos, right? And in the mats, 9,124 pesos for one person every 6 months. And I know you would like to know how much is that in US dollar. So I make an exercise too, so you can have an idea how is the lowest price you're going to pay with the minimum coverage, and how much is the higher plan with one of the best coverage you can access to. So this is the sample. Oh, the presentation I have something. I'm sorry, but it says the approximate in US dollar for one person under 65 years old per year in US dollar is lowest in the lowest local plan is 354 annually, right? You will still have the options to lower if you change the payment form, and as highest as $1,985 annually, which is the plan with different options. So you have an idea, but you can exactly know how much you're going to pay if you can access after the meeting, right, and make a quote for you. Okay, we just talked about the local plans. And because of the time, we didn't going to enter in global health plans, international plans, because it will be much time. But so you can have an idea, they have other plans that have great coverage in the country, also more coverage than you can have in the platinum, and also more in other countries. So if you feel, if you want it, we can check it after the meeting. Another question, am I an insurable person? Why these questions? Because many of us, as we talked earlier, you have coverage, as someone like to call it, fully coverage in your country. And that's interesting because maybe you have a condition right now, maybe you have age that maybe you don't feel sure if you won't have coverage in the country, or maybe you hear people talk about issues in the health insurance in the country. We need to know something. The simple answer, am I an insurable person, is yes. You can feel free, you can feel comfortable with that, but not at the same level. Why? Because, you know, health insurance is a community of people conformed by healthy young people, adults with working hard, and with others with extremely or frequent needs of attention in relative to health, right? And because of that risk, because of the age, because at the time you are hiring, the coverage will be different. You can receive more or less. Maybe you won't get the best coverage that the country have, but maybe because of your age, your conditions, you couldn't access to that. But still, you will have coverage. And that's why we make a little explanation of that. So the longer you spend out the insurance coverage, the less possibilities you have to get higher coverage, right? And we could talk about some exceptions and exclusion that explain a little more the why of that question. For example, every company in the country have exceptions or requirements that every affiliate have to fill in order to get the insurance. And even the health insurance company have to offer something attractive that you don't only feel that you are spending your money and not getting results. And that's why Humano has requirements too, but this is a good time that we are, because years ago maybe we can only say we have those exclusions and that's it. We don't have to talk about it, about the topic. But those exclusions, limited age to getting 65, and any pre-existing conditions, that's right, that's the requirement the insurance company has. But any case is evaluated particularly. That means maybe you have 66, maybe you have 67, or maybe you have any health condition, maybe not that bad, but you have it. So the company wants to know a little bit more about you in order to know if they can use that exclusions, and that's it, or it can be flexible and maybe give you the insurance with an extra payment, or given the other coverage you can access to. Don't get me wrong, that does mean every insurance company you will go, including Humana, you can go and no matter what happens, you will have the insurance. No, maybe you can find out this are not for you, but because they evaluate your particular case. But in other instances, and I have several examples of that, get other people that have more than 75, and because of his good health and habits and all that kind of stuff, they have access to the insurance they want. Or other coverage, but they have the insurance. Okay, after all being said, where to start? What we have to do to get access to the health insurance? Well, The first thing you need to do is identify your own needs. Because I can offer many information, I can offer many options in the plans, but maybe your needs are other. So you have to identify your needs, where you're going to live, how much maybe you want to spend in the health insurance, because you have other invests to do and other things that are important to do. So you can have to put the amount specifically in each categories. So after you do that, you can now access, you can get knowledge of the coverage, the plans, the payment for, the exclusions, the exceptions that you will have in order to get your health insurance. And that's why I'm here. You can contact me by email, by WhatsApp, or other questions that you have, well, right now, or after next door, you can pass and we can talk about it a little more. And I told you earlier that this is a good time because years ago, maybe you could have an insurance assessor, but maybe the hands are tired because the insurance company have their requests and you don't have nothing else to do. But now, because we have access to talk particularly with you, so we can know which are your needs, and representing you from the company and expose them and see what answers, what solutions we can have for them. So feel free to do that. Well, any questions you like to do? Yes, please.
Humano here have any relationship with insurance in the United States?
Say that again.
Okay, you can repeat it, please.
Is there?
Okay, I can repeat it.
Does Humano here have any relationship with Humana Insurance in the United States?
You know that this is a good question. I heard it well. I heard it well.
I just want everybody else to hear it.
Oh, I'm sorry.
You just need to put it close.
Lamar, say it again.
Does Humano here in the Dominican Republic have any relationship to Humana in the United States?
I was telling, this is a good question because yesterday I was talking with my brother, and he recently go to Miami. He said, hey, there's a Humana in Miami. And he said, oh, this is the wife of Humana, maybe. But the answer is no. They don't have a relationship at all.
Because I have it there.
Okay.
And I am well past that age.
Do you have an aversion to like mics? He refuses to talk into the mic. Who else has a question? Oh, here we go.
A couple of questions.
All right.
The first one is, our telephone's representative able to speak English when you contact them?
This is another good question. Yes, but not that extended. Not in all kind of stuff you need to do. But the global health insurance, yes, they have exclusive access to the language English. And maybe others, you can have information in English, but maybe not that big. Either the forms you have to fill, they're in Spanish too.
Okay.
But we can help you with that.
And then talk about the hair service.
Hair.
The helicopter.
Okay.
So is that available in any location in the DR where you live?
The ambulance in the national territory, yes, including the private.
So let's say I get a heart attack in the middle of the night, and I call the air ambulance, where they come wherever I am and transport me to.
Air ambulance, and they have a asterisk is they need a place to land in, but maybe you are in a building that don't have that access, but they got access to the near place they can land and maybe use a land ambulance to get into you. That's the solution of that.
Okay, any other questions? Healthy people, huh?
Yeah,
You're not worried at all, are you?
Any other major hospitals besides in Santo Domingo and Santiago?
Repeat again, please.
Any other major hospitals outside of Santo Domingo and Santiago? Like, is there anything in Puerto Plata or Punta Cana?
You say if we have offices right there?
No. Talking about the hospitals, medical facilities. Yes.
Oh, yes. In Santiago, they have, it calls, I forgot the name. Maria, you can,
No.
what's his name? Hams, that's right.
Outside of Santiago and Santo Domingo.
Yes.
Yes? All over?
Yes, they have many of them.
Yeah,
Okay.
really good hospitals.
Really? Okay.
Absolutely. That give great, the funny thing is, I was in a resort and they had an hospital right in the complex where I was staying. Hospital is a very good medical facility, and they have them like in all of the tourist towns. They also have them in the city. And they give very good, medical assistance. Of course, all I had was an ear blockage, but you never know. It could be worse than that. Anyone else? There you go.
Under a family plan, like if your wife has it, does the husband get included, or they treat it differently per contract?
Well, you can have access both ways in that. Get a new one just for you, besides the one they have, or you can be included down her, and she will continue as titular, as the holder of the policy. You can have it too.
Yeah, she would be the principal, and then you would come
That's right.
as a beneficiary.
This is stated. For a lot of people that live like in the tourist towns like Puerto Plata, Sosúa, they have what they call an international office where people are bilingual, speak Spanish and English. I would say find somebody in there and take care of them. Become their friend, because they'll be vital to, like, if you get sick or something happens. I know, like, my girl in Puerto Plata in Bornegal, anything that happens to me, I get her involved, and she takes care of everything, everything, any doctor that I need to see, any specialist, cardiologist or whatever. I give her a call, and she pretty much takes care of that. So, like I said, if they have that international office, walk in and introduce yourself and take somebody to lunch or something.
Oh, thank you for the experience. And you know something? I have clients resides in Puerto Plata, Las Terrenas, Santiago. Santo Domingo is the main group of people I talk with them and assessor them. But also that allows me to know information how the services works around the country, because something is you read it and then you feel it, you use them, right? So I can, in Español, fe testimonio about the customer service that we have.
Excellent. Anyone else have questions for Javier? Well, great. Javier, thank you so much. Very good. Excelente. Muy bien.